Narcotics and stimulants have played a big role in the history of medicine. It can be said that they have significantly influenced the culture of the 20th and the 21st century. Their use impacts the lives and the work of writers and artists in a simultaneously creative and destructive way. MDMA, better known as ecstasy, has long been associated with rave culture and electronic dance music. However, a latest discovery sheds a different light on a popular stimulant, as it is now being studied for its benefits in treating severe PTSD, depression, and certain types of anxieties. If you are interested in the new methods of treatments, this podcast will be perfect for you.
German chemists originally synthesized MDMA or ecstasy for pharmaceutical purposes in 1912. During the Cold War, the CIA experimented with MDMA as a psychological weapon.
In 1970s, some psychiatrists began using MDMA as a psychotherapeutic tool. They thought it made their patients more willing to communicate and participate in the psychotherapy process. Therapists called the drug Adam because they felt it returned patient to a more innocent state.
But by the 1980s, ecstasy had become more widely known as a party drug.
When I was searching for information about the history of MDMA, I found a very interesting article about the electronic dance music culture. An anonymous person said that it doesn't take a genius work to work out that staying up till 6 a.m. listening to dance music at an ear-splitting volume would not be unenjoyable without some kind of mind-altering stimulant, but a painful test of endurance. Most people in big nightclubs are on drugs.
Probably everyone has heard of MDMA, but do they recognize it better via its alternative names, ecstasy or Molly? So, from a medical standpoint, what is this drug?
Methylene dioxymethamphetamine, or MDMA, has both stimulant and hallucinogenic properties. It can bring feelings of happiness, euphoria and empathy. Users have reported feeling energetic and more emotional. MDMA is usually taken as a pill, capsule or tablet. The pills can be of different colors but sometimes have cartoon-like images or words printed on them. But most importantly, it is registered as an illicit substance, in other words, illegal. MDMA is a Schedule I drug. This means it has the highest potential for abuse and addiction. Some time ago, ecstasy was considered only a weekend drug.
Currently, selective serotonin reuptake inhibitors, SSRIs, have evolved to be a silver bullet for the treatment of depression and anxiety. SSRIs are the most frequently prescribed drugs for depression, yet a large number of well-controlled studies and the meta-analytics research puts in the perspective that SSRIs, compared with placebos, have little or no benefit for people with mild to moderate levels of depression.
Other sources claim that antidepressants are not free of serious adverse effects, including sexual dysfunction, rapid weight gain, and most troubling, suicidal ideation, especially in younger patients.
Yes, it's true. The question is whether or not there are drugs that could relieve these emotional and psychological problems effectively and reliably, without the debilitating side effects. Current treatment for post-traumatic stress disorder involves reliving the traumatic event and re-experiencing the fear it elicits. But MDMA reduces the amygdala's response to treat, thereby minimizing the effects when reliving the experience.
But these drugs are illegal and may be dangerous. Addicts are rendered dysfunctional in their relationships, become blind to reality, and are incapable of controlling their impulses. On the other hand, doctors are prescribing analgesics, both opioid and non-opioid tranquilizers and antidepressants, even though all these substances are known to be addictive.
MDMA has been around for a long time. It's now being studied for its benefits in treating severe PTSD, depression, and certain types of anxiety. We still don't know enough about the drug's effects on the brain. The newer studies show some promise. We will know more about the best dose, results, and any long-term side effects once the studies have been completed. However, remember, MDMA is still a drug and is very often mixed with other substances like methamphetamine or bath salts.